Dizziness and vertigo are often misdiagnosed and often overlapping. Dizziness is more of an unsteadiness, instability, often described as lightheadedness at times, whereas vertigo is quite different. Vertigo is a false sense of spinning. It could be directional in one way or the other, and also can be forwards or backwards. They're often used interchangeably, but medically they mean something quite different. They often originate from different parts of the brain or inner ear. So you definitely want to be able to differentiate between both dizziness and vertigo for management and treatment of both conditions. Vertigo can come from different structures of the inner ear, brain, and other parts of the body. We can get inner ear conditions such as Meniere's disease, migraine, benign paroxysmal positional vertigo, and other inner ear conditions. We also can get vertigo that comes from other brain-related areas, from the brainstem, the cerebellum, and other higher areas of the brain when there's a bit of a malfunction that occurs in these areas that can contribute to vertigo. We also can get vertigo that comes from inappropriate or even properly prescribed medication and as a side effect of combined medication, but also can be caused from serious or other conditions that need to be investigated as well. To be able to differentiate dizziness from the inner ear and other parts of the brain is really important when it comes to management of these conditions. So if it's an inner ear cause to their dizziness, typically there'll be other auditory symptoms like tinnitus, fullness in the ear, and ear pain. Also the directionality of the eye movement, whether it rotates or moves horizontal or vertical, and whether it fatigues after certain exposure, can help identify whether it's coming from the inner ear. Outside of that, dizziness can come from other parts of the brain, and that may then lead to you investigate whether there's nausea, whether there's instability, whether there's anxiety, whether there's other symptoms like sound and light sensitivity, weakness of the face and facial muscles. All these may indicate that there might be a cause other than the inner ear. So it's best to investigate where the issue is coming from.